Germany. Two books are on display at World's biggest library at Alexandria, Cairo. He has published 30 articles along with 7 in peer-reviewed articles. He is a series lecturer in Imperial College London, UK, University College London, UK, Zurich, Swiss Federal Institute of Technology, Switzerland, University of Chicago, US, National University of Singapore, IIT Kanpur, IIM Ahmedabad. Let's welcome our next speaker, Dr. Kaushik Das Mahapatra. Over to you, Dr. Kaushik Das Mahapatra. Please take
Thank you.
timeline.
Thank you, sir.
Thank you very much.
Dr. Sushil. So, dignitaries on and off the dais and delegates. My topic is depressive disorder in young generation and their rehabilitation. So coming to the introduction, when we say the mood disorder in the psychiatric parlances, it is basically known as the bipolar disorder. In this disorder, the fundamental disturbance is change of mood or affect. Mood change is normally accompanied by a change of overall level of activities. Other symptoms are either secondary to or easily understood in the context of and on the onset of individual episodes often related to the stressful events. My points to be discussed: the prevalences, biological factors, psychological factors specific to younger generation, depression at different stages of life, and some female specific disorders and their management. So prevalences, almost 20 to 30% young at some state of their lives suffering from mood disorder, but all are not clinical depression. Unipolar depression is the second major cause of disease burden, and in male 10th. But unipolar major depressive disorder is more common in male. No gender difference is found in MDP, manic depressive psychosis. Seasonal affective disorder, rapid cycling, is more common in women. Earlier onset, longer recovery times and recurrences are more common in male. Now, suicides, Dr. Pankaj already discussed. We will just go through the overall superficial things. It is now a major national public health issues in India, and he said that 12.4% per lakh population in 22, which is highest in the disease. 1.71 lakh suicide were recorded in 2022. And it is increased by 4.2% from 21 and jump into 27% compared to 2018. Means around 480 suicide per day and 20 suicides per hour. So by the time we will finish our session, we will lose 20 people through suicide. So these are the suicide rate according to different states. First is Sikkim, then Tripura, then Kerala, then Chhattisgarh, and Arunachal, Goa. So Delhi is nowhere, right? No. Delhi's union territory is 15.5%, they jumped into 8.8% since 2015. So day by day, year by year, these are increasing. Who suicides? These are the ratio. Daily wages earner are most of them. Okay? Then housewife, and then the self-employed person, then salaried person, then students and farmers. And the other person you are seeing, those are army men and different other people. So biological factor, younger age. In puberty, higher incidence of depression is found. Some hormones like estrogen modulates a number of neurotransmitters involved in mood regulations. and no evidence of progesterone worsen the mood at this age. Later, after menopause, it causing depression. Devastating stresses like sexual abuse that may cause a long-term dysfunction of pituitary hypothalamus pituitary axis and lead to depression in women, and gonadal or hormones also involving 5-HT and glucocorticoids. At perinatal stage in women, 10% pregnant women suffer from depression. Rapidly fall in estrogen and progesterone coupled with prolactin and oxytocin also causing depression. Fall in the level of antidepressant in blood level in postpartum depression. And hypothyroidism, if it is there, it will increase the chance by 9%. In perimenopausal period, recent studies shows that association between transition to menopause and depression. And there are certain Ayurvedic drugs which will cause a painless, uneventful menopause. Prolonged perimenopausal period and presence of vasomotor symptom increases the risk of depressive symptoms. And responsible factors are changing in estrogen level, elevated FSH and LH level, and neuroendocrine and circadian rhythm changes. Now, psychosocial factors in general, not specific. Lower income, we all know these things. Dependence, conflicting scenario of male and female dominance issue. Emerging concept of single parenting, unwed mothers, caregiving responsibilities. कौन बच्चे को देखेगा, कौन सब्जी लाएगा, सारा काम कौन देखेगा. Domestic violences, increasing concept of working woman. Gender biases at different levels. Circumstantial vulnerability for psychosexual harassment at workplaces, जो काफ़ी हद तक हो रहा है. रिसेंटली आपने आरजी कौर मेडिकल कॉलेज में भी देखे हैं कैसे हुआ है वो केस. Decreased psychosocial support system back home due to emerging trend of nuclear family system. पीछे से कोई देखने वाला नहीं, हस्बैंड वाइफ दोनों ही जॉब पे गए हैं, सब कुछ देखेंगे कौन. Effects of ongoing struggle for women equalization. Now, specific at adolescent, early attainment of physical maturity increases the proneness of sexuality. Dissatisfaction with the weight, increased pressure-related sexuality, sexual abuse, frequently changing interpersonal relationship, restriction from family, teachers, hostel wardens, seniors. At perinatal stage, either past history or family history of mood disorders, single marital status and marital conflict, poor quality of social support, greater number of children, poor health functioning, alcohol abuse, any psychoactive substance abuse, rather two young parents, and in midlife, life transition first it will come. Children leaving home and starting with their own families, that is called empty nest syndrome. Loss of or caregiving to parents and spouse, occupational disruption, marital changes, and interpersonal role confusion. Now, in Ayurveda, it is called Visad, right? So, these are some technical terms that Oj and Ras Dhatu, it becomes down. How it will increase? Basically, proper food and exercise. In Ayurveda, it said Ahar and Vihar, that is your lifestyle and food. Those is basically bath. Now, I am just giving all the things and just trying to make you understand what is the basic funda in this thing. Ras Dhatu is basically produced by the proper diet, right? If you are not taking food in proper time, then it will make difficulty in both body and mind. The proper channels will not open, so there will be sanga, means obstruction in the body. And that's why Bisad will come. What food do? Basically, food does, it basically proper, if it is taken in proper time, proper quantity and proper way of processing, then it will produce the neurotransmitter, hence the hormones of depression will produce. Right? So, and the disease is basically chronic. What kind of depression common in young age? It's atypical presentation. Dr. Pankaj already discussed. Reverse vegetative sign. It is specific to female. Hypersomnia, नींद बहुत ज़्यादा आते हैं. Increased appetite and weight gain. And some historical depression like pain symptoms, anxiety, chronic dysphoria, and mainly somatic symptoms found in women. Okay, and these are the spectrum: mild, moderate, severe, with psychotic symptoms, without psychotic symptoms, and some unspecified depression. And in case of recurrent depression, similarly, mild, moderate, severe, with psychotic and without psychotic symptoms, and remission. Now the clinical features, how it will be in adolescent: irritability, hopelessness, anhedonia. Anhedonia means inability to experience the pleasure. उसको कुछ भी ला के दो, किसी भी हिसाब से ठीक नहीं होते. एक फेमस टेनिस प्लेयर है, नाम नहीं ले सकते हैं उनके, साइकियाट्री में नाम नहीं बता सकते, किसी को परिचय नहीं दे सकते. तो उनका ये कहना है कि डिप्रेशन में है. मैंने लग ऐसे 5 चीज़ बताइए जिसको आपको मिल जाने से आपका डिप्रेशन चली जाएगी. तो जूनियर लेवल में है, तो बोलते हैं कि इंडिया की तरफ से वो अपने देश को रिप्रेजेंट भी कर चुका है. बोला पापा अगर मेरे साथ बात करें, तो ठीक है. एक दूसरा कि पापा बहुत बिजी है बिजनेस में. सेकंड, पापा बहुत सारे कपड़े ला के दें, ठीक है. और मुझे कहीं घुमाने लेके चले, मतलब वो पहले जैसा ही हो गया, टाइम देना है ना आपको. हाँ, तो 5 गिना नहीं पाए. उसके स्कूल लेवल में परफॉर्मेंस भी बहुत अच्छा है, एकेडमिक परफॉर्मेंस बहुत अच्छा है, स्पोर्ट्स में बहुत अच्छा कर रहे हैं, फिर भी एनिडोनिया है. द चेंजेस इन स्लीप एंड एपिटाइट, एकेडमिक डिक्लाइन, रिड्यूस एनर्जी, सर ने अभी बता के गए हैं, कुछ भी करना चुपचाप पड़े ही है बस. Reduce social interaction. Now somatic symptoms like headache, abdominal pain, pervasive sense of boredom, हमेशा बोर ही रहते हैं. Smoking ऐसे चीज़ों को और बढ़ा देते हैं. Suicidal ideation and some atypical symptoms. Now in pregnancy, they are reluctant to disclose, and changes in sleep and appetite, fatigue, and a postpartum depression affect 10 to 15% of patients. And the major problem is depression begins at the postpartum periods. It's gradually giving onset of bipolar disorder, late onset bipolar disorder. In case of vasomotor symptoms, sleep difficulties, hot flashes, night sweats, irritability, most young individuals perceive these symptoms as a natural part of aging. But it's not like. And what are the treatment problem? Treatment, he said about the treatment, but the problem we face that exclusion of childbearing age from the clinical trial. In adolescent, cognitive behavioral therapy is very useful, but the problem is patient is not adherent because of young age. उनको पढ़ाई है, उनके काम है, फिर सोचते हैं कि क्या एक ही बात तो बार बार बोलेंगे डॉक्टर. Misbelieve that embryo and infant, might expose to medication, and in Ayurveda, it is said to be 6WHHD, and that is you also found in Gita. What we do, what it said basically, that through the examination of medical reports and history, then acceptance of patient and his or her complaint of legitimacy, and schedule the regular visit with clear points कि आज के दिन आपको ये हम लोग ये करेंगे, कल ऐसे करेंगे. Using clear and simple language with unambiguous terms, and providing relevant information and explanation, and fostering the patient's responsibility towards his or her treatment. पेशेंट को भी अपना रिस्पॉन्सिबिलिटीज हम लोग समझा देते हैं. कुछ अगर काम नहीं देंगे तो वो नेक्स्ट टाइम सीधा हमारे सामने आके बैठ जाएंगे कि आपने जो जो बोला मेरे से कोई इम्प्रूवमेंट नहीं हो रहा है. तो एक क्लियर कट इंस्ट्रक्शन रहेगा कि आज को चाहे वो पॉइंट आउट करके ले आए, चाहे कुछ भी लिख के ले आए, या फिर एक के बाद एक क्या इम्प्रूवमेंट हुआ कि उससे ख़राब हुआ, वो सारे बताने हैं. shifting attention from physical symptoms to underlying physiological and social problems and focusing on patient asset. पिछले महीने बर्मिंघम में एक कॉन्फ्रेंस में वो बोल रहे थे कि आपके हिंदुइज़्म में ऐसा क्या लिखा है, जो आपकी किताब में भी हमने देखा है कि ये 7WHJ या फिर जिस चीज़ के आपने लेक्चर दिया था उसमें बाकी चीज़ों से कॉग्निटिव बिहेवियरल थेरेपी, सपोर्टिव थेरेपी, इमोटिव थेरेपी, इन सब चीज़ों से अलग क्यों है? तो मैंने बोला कि ये सारे चीज़ें हमारे धार्मिक किताबों में लिखा है। अगर आप धर्म से थोड़ा सा अलग जाएंगे तो आप कुछ भी नहीं कर पाएंगे। आप अपने बाइबल से अलग नहीं जा सकते, तो हम लोग अपने वेदों से भी अलग नहीं जा सकते, ना गीता से अलग जा सकते, और ना कोई मॉडर्न पेशेंट या सब्जेक्ट वो अपने धर्म से अलग जा सकते हैं। जैसे ही हम ऐसे करेंगे हमें कुछ ना कुछ और चीज़ें इनगल्फ करते जाएंगे, हावी होते जाएंगे, हम उसको काउंटर नहीं कर पाएंगे। Adjusting a reassuring style in a way of effective for a given patient, providing repeated reassurance, and this is the cognitive therapy he said already. Unstable mind is not good. Prevalent anger, dejection, tension, and other mental subnormalities. Avoid violation of customs, avoid quarrel and misbehavior, and these are the suggestive third psychotherapy, that is thoughtful work, delightful mind, be truthful, peaceful, expert, gentle and have patience, offer respect to other people. And these are the Ayurveda treatment. These are very simple, anybody can use this thing. But among this, Brahmi is one of the drug, it is available everywhere. If you tell your patient who are in depression, they will feel better. The psychological sophistication will increase, and the other Shodhan therapy, that is Punchkarma therapy, and along with Sirodhara, Sirovasti and Yapanvasti. So lastly, we must remember the cars like Honda City is basically made for the smooth way, not for the ordinary roads. We cannot afford a single death due to suicide anymore, Dr. Sushil said. A young person is who is basically naturally soft and elegant, please don't put extra burden on them or don't do anything that led him into depression. So let them be as they are. Thank you. Pressure treatment for for 1 month, not more than 1 month. In 1 month or 2 months after, it will cause depression. So it's better to avoid. There are several other drugs.
Other drugs now that we have.
Yes.
Yes. Now, you mentioned a drug called Ashwagandha.
Yeah.
For treatment of depression. It has been used for n number of things in Ayurveda.
Yes.
Any contraindication of using Ashwagandha?
There is no basic contraindication, but it can increase a little bit blood pressure after using continuously for more than 7 months. Okay. That is reported in different research papers.
Okay, and is there a dose of Ashwagandha? Because many of us use it.
No, it's a 500 milligram. Usually tablets are made. 500 milligrams twice daily is no problem. So after 3 months you give gap. But the safest drug is Brahmi. You can continue for whole life.
Brahmi?
Yeah.
Okay.
That is a non-sedative antidepressant. That's very good.
And the dose of that?
1 tablet twice daily. And sometimes you can, if you have the liberty to make it 1 tablet once daily, or you can give a gap for 1 day, 2 days.
Thank you very much, Dr. Mahapatra.